We're at Dr. Tavakolian's office.
Come on in. Okay, and then I want you to look straight ahead. But I don't want you to look up here, and I don't want you to look down here. I want you to look like right. It always takes a couple just to make. You have these growth factors in your serum that stimulate collagen and elastin production, and that's kind of what we're leaning on with this injection. So we hope that you have stimulation of those things to overall rejuvenate, kind of revive, refresh your lower lid skin.
That's another thing I've been noticing lately too, is like I've been using less and less concealer under my eyes, only not because I don't want to, but I have so many like little, like it like gets stuck in the areas, and so I find myself kind of like trying to pat it out of the line, so I'm hoping this kind of helps with that too a little bit. What's the downtime for something like this typically?
No real downtime except for, I say don't work out the same day. Don't get a facial shortly afterwards, just because you don't want to displace something that you just injected. And then don't plan it right before an event, just because eyelids bruise very easily.
Okay.
So
let's do it. I'm excited.
Yeah.
I'm sorry, what? I've used a lot of my plasma in my life.
Test tube, or the tube that we put the blood sample in, has a chemical agent in it that helps separate the red blood cells from the plasma portion and where the growth factors are found. And so this will go for 10 minutes, and then after that 10 minutes I'll take it out and you'll see those two components are totally separate from each other. And so that's how it's done.
Princess Goals. Look at that.
Okay, so now I'm just going to go under the eyelid skin. This is the part where, even though I'm not using a needle, it's going to be pressure as it moves through. Okay, and then I'm going to pull back to make sure that I'm not inside of a blood vessel. So there's no blood coming out, which means there's no blood inside. And then I lay down a track of PRP on my way out. I don't come all the way out, so that we save entry points and we don't make more stabs. And I'm going to protect your eye as I move the blunt cannula closer. I'm going to pull back again. There's no blood, which means I'm not inside of a blood vessel. So we injected your lower lids, and you're obviously very puffy. We did this one first and we did this one second, so you can tell that the swelling is already going down on this side, which is why this side is more. And then we had a little bit left over, and so we did some on your hairline too, because we love using our PRP wherever we can.
We don't.
And why not?
We don't waste plasma.
We do not waste plasma. So you'll be swollen today. And that should just continue to go down. You can do, little ice packs if you want.
Okay. Okay, well,